surgeons are aware that by virtue of the surgery they do, that they are going to disrupt the lymph glands and cause soft tissue injury in the axilla. So they do accept that patients are going to have some scarring and some dysfunction. So to limit this dysfunction, they give a standard protocol of stretching exercises to everybody. And for those who aren't affected, the majority, who aren't affected by cording, which is probably the majority, they do well. So this becomes the standard treatment for everybody. So as I've already mentioned, in my nature, I followed the protocol I was given to the letter. So imagine my shock when I went to my specialist for the first monthly review, when with concern, my surgeon said, "You're behind, you're nowhere near where you should be with function of your shoulder." But imagine how disappointed I was when I knew I had followed the directions exactly as expected. Now, the plan with exercise, the stretching exercises, is the doctors want patients to get full range of movement of their shoulder. So they're asked to gradually creep their hands up the wall, each day trying to get further until they've got full movement. Now, when you haven't got any taut cords like poor old Dr. McStubbins has presently got, it's quite straightforward to get up. But realistically, how can anyone expect someone with cording, the cords firmly anchored in the axilla, how can you expect someone to really get much above shoulder length? Basically, I remained behind. But over time, my cording had healed. I couldn't see it. I felt I had good shoulder movement. I could do my bra up again. So for all intents and purposes, I'd healed. But I did have ongoing problems. The main problems were I was tight in my upper back, I had a sore neck, and I used to get dizzy from my neck, and I had the occasional bouts of vertigo. And I now know these are sequelae from untreated cording. And they did not improve naturally. And I was to contend with this for 15 years, only ending when I had the correct treatment. That is, treatment directed at the scar tissue that the untreated cording had caused. So given the consequences of missing it can be debilitating, how can we ensure cording is not missed? Well, it's simple really, because the cording for the patient themselves is easy to diagnose, which I'll explain more later. Being one's own self-advocate, knowing that if things aren't right, they need to see somebody, knowing that it needs specific treatment, it's not going to get better of its own accord. And if there's any doubt, seeing a rehabilitation practitioner is vital because you can diagnose it and treat it all in one. But even if missed, like what happened with me, it's never too late to seek treatment and expect benefits.